Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. C.Difficile and colon cancer correlation. Clostridioides difficile is a causative agent of colitis. And when we talk about colitis, we are talking about inflammation in the large intestine. That region is always causing us abdominal pain, bloody stool at times, diarrhea, and these are usually caused by these resident organisms. C.Difficile. But the funniest thing is that it is a normal flora that will not harm if nothing disturbs it. But once it is disturbed, especially by antibiotic intake of a patient, regardless of the age, you will now find it producing toxins. It produces toxin A and B that will now result in this diarrhea and gradually causing inflammation. This reaction of the C.difficile is now the problem. It is what is now being suspected, because when tested in dogs, it was discovered that it could cause tumor. And when you are talking of tumor, you are more or less talking of cancer. So if we are talking, linking it or suspicious about its causing that colon cancer that is now killing people. One of my friends, or a very known person, died just on the 18th of November 2025, not long distance time ago. And before what he told me, that he was just always feeling pain, abdominal pain, before eventually it was diagnosed to be needing that surgery to remove part of those tumor, which later ended his life. So the care or the knowledge of this colitis and the incrimination in probably causing colon cancer is something that should be very wise. Wise people should catch up to it. Knowledge is power. We need to know more, and I am going to expose more on how it could be the cause. As already research has gone far into it to know the implications. Colitis is not only caused by Clostridioides difficile, it could also be caused by the enterohemorrhagic E. coli and other organisms and parasites that we know. But what my main concern now is just on this area, which I shall expose in full details as we move on into the slide session. As usual, click the like button, subscribe. More will come your way. The outline: objective introduction, research finding, laboratory diagnosis and treatment. The objective: to create more awareness of chronic colitis caused by Clostridioides difficile and how to diagnose it early enough and eradicate it before it graduates to other conditions. The introduction: Clostridioides difficile was initially known as Clostridium difficile before more genetic studies placed it in the appropriate genus Clostridioides. It is a gram-positive spore-forming rod found in the colon that causes diarrhea, colitis, that is the inflammation of the colon, and can be life-threatening. Most cases of C.difficile infection occurs when you have been taking antibiotics or not long after you have finished the antibiotic course. Like I said in the preambles, it is a normal flora, but once disturbed, the microbiota of the abdomen, the large intestine, then there is a problem. It starts producing some toxins that the body cannot withstand, and that results in inflammation. Yeah, inflammation may create that condition that will allow the tumor cells and all these other to really grow. It is highly contagious and can survive outside the body in spore forms, making it difficult to eliminate. It is an anaerobe and is resistant to many disinfectants and can persist in the environment for a long time. It is transmitted by spread of spores that persist on surfaces. When we talk about surfaces of skin, the places, anything that your hand could touch, and you can now ingest through the oral digestive route, and so we really infect ourselves more or less by that means. So regular hand washing would help prevent that transmission. We must be clear that the transmission is through the fecal oral routes, and that could be prevented by frequent hand washing. And in terms of prevalence, Clostridioides difficile causes nearly 600,000 infections annually in the US, with around 29,000 deaths. Although commonly linked to healthcare setting, up to 40% of infection now originate in the community. We have community borne infection, and you now find that because of this soiling and the surface contamination, the infection is more community bound and often following antibiotic use. The risk factors are recent antibiotic use, age. Once you are age over 65 and you experience chronic colitis, you need to really wash it before it becomes something else. Hospitalization and weakened immune system, the HIV infection, and where you are not really taking your vitamins or eating balanced diet, that could affect your immunity or your immune system and become weakened. So these are the risk factors. Yeah, now let's see how it's correlated with colon cancer. That is the infection of C. difficile, the colitis extending to become colon cancer. The recent studies suggest that C. difficile may contribute to the development of colorectal cancer. Research indicates that more than half of patients with colorectal cancer have bacterial biofilm. When you talk of biofilms, these are a kind of plaque, a place where bacteria really domicile and form a cocoon, which are dense collection of bacteria, including Clostridium difficile. In animal models, C. difficile has been shown to induce colon tumor, particularly when the bacterium produces a toxin known as TCDB. The presence of C. difficile alters colon cell behavior, making them more susceptible to cancerous changes. All these are research findings, so many that you probably by now you would have concluded that it causes colon cancer. The laboratory diagnosis. Because C. difficile is a normal flora and a member of the microbiota of the large intestine, there is a need to distinguish between the colonization of the area, that is asymptomatic C. difficile, and the real existing C. difficile infection. Without much ado, if there is an infection, there will be diarrhea. So is that diarrhea that is examined? So that forms the basis. So laboratory testing could help distinguish between the asymptomatic C. difficile colonization and symptomatic CDI. A patient presenting with no diarrhea and a positive PCR test and a negative EIA test likely has C. difficile colonization. So it is normal flora in that experience. So the laboratory test requires observation of at least 3 unformed stool in 24 hours. Unformed stool are diarrhea stool. Then perform the PCR test stool toxin test, the EIU test, and possibly to confirm that the patient is inflamed, the colonoscopy, and then the biopsy also will help to confirm that there is cancer. Finally, to treatment. We can't talk about treatment without knowing how to prevent it. To prevent it, C.Difficile spread through spores. That knowledge will help us that it can survive on surfaces and hands. So we must make effort to wash our hands regularly. Frequent hand washing with soap and water would help. Disinfecting surfaces, because the spores can always stay there, with bleach-based cleaners, hypochlorites. Avoid unnecessary antibiotic use, that has been mentioned. Treatment, therefore, involves vancomycin, dexamethasone, flagyl. In severe cases, hospitalization may be required, and surgical intervention may be necessary for complications like toxic megacolon, as shown there. So, more health videos are on my YouTube channel. This should be the 208th video. I'll still counting. So please subscribe and watch more. Thank you.